Hello, and welcome to my presentation on nutrition and osteoporosis health. My name is Serena Mack, and today I'll be talking about the disease osteoporosis and the implications of having this illness. More specifically, this project is going to detail the ongoing controversy that occurs over treatment of osteoporosis today. To begin, osteoporosis is defined as a skeletal disease that is characterized by certain physical symptoms. These ailments include having low bone mass and a progressive deterioration of bone tissue over time. Those that are most likely to be affected by this illness are older women, 65 years and older. One of the major causes of osteoporosis is genetics, making this disease categorized as inheritable. Osteoporosis is a polygenetic disease, meaning that there are multiple different genes that affect the likelihood of inheriting this illness. Most of the genes that have been found in connection to osteoporosis have also been found to influence the regulation of bone mass in the human body. Additionally, maternal nutrition during prenatal development plays a role in an individual's risk of developing osteoporosis. The dietary choices of a mother during her pregnancy have long-term impacts on the bone health of her children. It is important for pregnant women to maintain a nutritious diet full of calcium and vitamins that support healthy bone growth for their developing child. Another cause of osteoporosis is early life malnutrition. Children who lack a sufficient diet full of necessary nutrients are at a much higher rate of developing osteoporosis later in their lives. A final cause that has been more recently started to be studied is the connection between a poor diet and the risk of developing osteoporosis later in life. Diets that are deficient in calcium and vitamin D have shown a connection to increased risk of developing this illness. All of the symptoms that are associated with osteoporosis relate to an individual's skeletal system, their bones. Symptoms include increased bone fragility, higher instances of bone fractures, and a progressive deterioration of bone tissue over time. Currently, there are multiple medicational options for people suffering with osteoporosis. These medications are known as biphosphates. They include alendronate, risdronate, and ibandronate. There are two categories for these medications, based on their specific purpose. Some of the osteoporosis medications work to speed up the bone building process in an attempt to counteract the body's increased deterioration due to the illness. Other medications work to reduce the rate at which an individual's bones are breaking down. Unfortunately, these medications are known to have some side effects, including digestive issues and severe heartburn. Another popular treatment for osteoporosis is through dietary measures and nutritional counseling. Current dietary guidelines for prevention and treatment of osteoporosis include an increase in calcium, vitamin D, and vitamin K in the diet. This can be accomplished using recommended meal plans and patterned eating that can be recommended by a nutritional counselor. It wasn't until the late 1980s that medical personnel began noticing a trend in decreased bone mass and began researching possible causes. There was an international agreement between scientists and doctors in 1993. This is when the first official definition of osteoporosis was decided upon. Following this event, the World Health Organization set forth diagnosis criteria for doctors to use when treating patients with the symptoms of osteoporosis. Their criteria is based on a person's bone mineral density, which is measured and compared to standard levels. Additionally, doctors look at hip and vertebral fractures as major indicators of progressive osteoporosis. These two locations on the body, the hip and the spine, are the most greatly impacted by osteoporosis. As of 2020, there is an estimated 10 million women who are affected by osteoporosis. As time passes, the trend in osteoporosis cases shows a steady increase. With an increase in cases of this illness, other medical problems have arisen for individuals affected by the disease. In the United States, there are over 1.5 million osteoporosis-related fractures annually. In the elderly population, these bone fractures can lead to severe disability and potentially even to death. There has been an increase in mortality and morbidity rates due to hip fractures related to osteoporosis over the past 20 years. Finally, the increase in hospitalizations and the necessity for increased medical care causes both social and economic burdens for any populations affected by this illness. There is a direct connection between nutrition and the risk of developing osteoporosis. Certain diets have been researched to either prevent or worsen the odds of developing osteoporosis in an individual's later life. On this slide, I have broken down the differences between diets that are suggested to improve and prevent osteoporosis in comparison to diets that show evidence in worsening the symptoms and the risks. Diets that prevent osteoporosis include those that are full of fruits and vegetables, supplying the necessary vitamins and nutrients that the body needs for healthy bone growth. Calcium and dairy consumption are also strongly suggested, as both foods provide necessary components for bone mass development and strength. Additionally, there's an importance for optimal maternal nutrition during pregnancy. As I stated earlier in the PowerPoint, dietary choices of the mother during pregnancy has direct impacts on the child's likelihood of developing osteoporosis. Diets that have been found to worsen osteoporosis include any nutritional intake that is calcium and/or vitamin D deficient. Also, there has been a research recently done that found a connection between lack of protein intake and the increased severity of osteoporosis symptoms. Finally, there is a direct connection between childhood malnutrition and later development of osteoporosis as the individual enters old age. Children who lack certain nutrients such as vitamins and calcium have been found at a statistically higher chance of developing osteoporosis in their later lives. As I stated at the beginning of this presentation, there is an ongoing controversy over the treatment methods for osteoporosis. This controversy over the issue stems from a disconnect between how certain doctors and scientists believe that individuals should manage and treat their osteoporosis. The most common medical practice for treatment of osteoporosis is the use of certain medications and therapy methods. It is only in more recent years that an argument for nutritional treatment methods has been advocated for in the medical community. On this slide, I have broken down the basis of each argument, distinguishing them as the use of medication versus the use of dietary changes. In terms of medicinal use, anti-resorptive drugs are prescribed for the prevention and management of this illness. These drugs are known as bisphosphonates, and they work to slow bone deterioration and/or rebuild diminished bone tissue. One of the newest drugs on the market for osteoporosis is denosum. This medication uses specific antibodies that target certain cell receptors on bone cells that are vital for growth and maintenance of tissues. Patients who take denosum experience improved regulation of the formation of osteoblasts and clasts in their cells, which help rebuild the patient's lost bone tissue. The other argument is one for the use of dietary and lifestyle changes in order to prevent the development of and lessen the symptoms of osteoporosis. One organization dedicated to advising on dietary guidelines is the National Osteoporosis Foundation. The goal of this organization is to educate individuals with osteoporosis on how to manage their symptoms based on their food choices and their patterns of eating. Additionally, they help connect patients with nutritional counselors and specialists who help implement better eating practices for management of this illness. Prevention of developing osteoporosis is also made possible through the use of dietary guidelines set forth by this organization. Current dietary guidelines include certain nutrients such as calcium and vitamin D that have been proven to lessen the symptoms of osteoporosis and decrease the risk of development. This includes the suggestion for increased calcium intake at young ages and ensuring that children are fed nutritious diets. The reason for this controversy is a disconnect between the two sides of the argument. There is a constant debate over the different types of treatment options for osteoporosis that directly influence the controversy. Biphosphonate drugs are recommended as the most effective treatment method. The debate is sparked over the side effects of these medications, as patients feel they are suffering and may be wary of taking them. Side effects include atypical fractures during early years of treatment. Another concept that came up during research is the necessity for what's called a drug holiday. This is when you take a year or more breaks in between treatment rounds of medications for osteoporosis. The reasons for these breaks is because of the side effects and the toll it takes on the physical body. Finally, there is a need for additional preventative measures in the form of nutritional recommendations. This disconnect between the scientific and pharmaceutical community and nutritional advisors needs to end in order to make true progress towards solving this controversy. Currently, there is much ongoing research into the treatment of osteoporosis. This includes advancements to both medicinal and dietary treatment plans that are recommended for osteoporosis patients. As I mentioned before, the newest medication on the market is denosumab. This is a drug that contains antibodies targeting specific factors in the human body related to bone growth and health. More specifically, it works to affect the production of osteoblasts. These are the cells making up new growth in bone tissue. The goal of the medication is to encourage the body to increase its bone mass growth in order to counter the symptoms of deterioration. There are many current guidelines that can be found on the internet for the prevention and management of osteoporosis. In my research, I found that almost all dietary plans suggested an increase in calcium and vitamin D and K. Evidence-based nutritional plans include certain fruits and vegetables that are stressed for their importance in delivering key nutrients to the body. There is also a suggestion for vitamin and nutrient supplements through the forms of pill supplements, and the addition of certain foods to the diet such as calcium from dairy products. Additional supplements that can be taken are estrogen and isoflavine. These two have been researched to improve bone health. These are new supplements on the market, and while they do not require a prescription, they can be considered a new type of medication for osteoporosis. I had debated between putting them between both sides, but I viewed it as a new diet plan because they are suggested in addition to a healthy diet, not in addition to different medicational treatments. As with any illness, there are obstacles to overcome when it comes to finding treatments and cures through extensive research. The ongoing controversy prevents an agreement in the scientific community over what the best practices are for osteoporosis treatment. Additionally, there is slow adaptation of new medicinal or therapy methods when it comes to implementation of new drugs. Countless tests have to be done before drugs can be put on the market, not to mention the extensive amount of time it takes to develop these drugs in a lab. Finally, there is a need for improved guidelines when advising on dietary options for the prevention and treatment of this illness. More research needs to be done looking into different dietary options and the suggestion of nutritional counselors to patients, presenting them with all of the options when it comes to their treatment of this illness. Finally, we have reached the conclusion of this presentation. At the top of the slide, I have included summaries of both treatment options for osteoporosis. In terms of medical treatment, current prescriptions for osteoporosis include the use of bisphosphonate drugs, as I have described in this presentation. These drugs work to slow the symptoms of osteoporosis and rebuild bone tissue in order to counteract any deterioration. Dietary treatments include lifestyle changes to the individual's food choices and patterns of eating. Current dietary suggestions include supplementing the diet with additional sources of calcium and certain vitamins such as vitamin D. These nutrients have proven vital to bone growth and maintenance of bone health over a person's lifetime. On this slide, I have listed some major takeaways that I think are important to retain after listening to this presentation. Now that you are more knowledgeable about the causes and symptoms of osteoporosis, it is important to understand the ongoing controversy over treatment methods. As I have described in this PowerPoint, there are two overarching treatment practices that make up this debate. On the one hand, you have an argument for aggressive medical treatment of osteoporosis using drugs and therapy methods. On the other hand, you have nutritional specialists testifying for the use of dietary guidelines and nutritional counseling in order to prevent and manage the symptoms of osteoporosis. There is a need for continued research into new methods for treatment, both medicinal and dietary. Doctors and scientists need to open their minds to a combination in treatment methods in order to resolve the ongoing controversy. Only when both sides of the controversy come together can true progress be made in the treatment and even potential cure of osteoporosis. This final slide includes all of the sources that I used throughout the duration of my research for this presentation. Thank you for listening to my presentation, and I hope that listeners are now more educated on the issues associated with having osteoporosis. Feel free to do further research into the ongoing controversies that surround treatment of osteoporosis and care of those who are affected by this disease.